So there's been a lot of requests for a kind of treatment planning series to really help you with kind of obviously forming that treatment plan for a patient. And obviously there's a few sides to this, and I think the two big ones are, first of all, you need the assessment skills to be able to figure out what's going on. And then obviously you need the clinical reasoning and kind of treatment skills to be able to plan a graded exposure treatment plan to get them wherever they need to be able to go. And we're going to focus mainly on the graded exposure and kind of treatment planning side of this, because on the mentorship we've got our kind of own assessment kind of system to figure out kind of what we need to treat. Now you might have your own assessment system, and that's absolutely fine, but we need to make sure that we've got the skills to be able to figure out what's going on, and then obviously the skills to be able to plan a treatment plan. Now, one of the most important things to start with is identifying any relevant previous history that we need to treat, which is obvious. Now, in the subjective assessment, most people will ask that question, but often you get the response of, oh, I haven't really had any previous injuries, or the patient just doesn't see why the information is relevant, or they forgot about it, or whatever. So what's really, really important is that we get a good idea of the relevant previous history, because that can have a big impact on how we're going to structure a treatment plan. So I might have 3 or 4 patients with knee pain with completely different histories, and obviously the treatment plan might look very, very different. The initial stages of desensitizing the symptoms, getting the knee pain to settle down, might be very similar, but obviously then the rehab after that depends specifically on the adaptations that person's had in response to previous injuries. Now, we know from the motor adaptations to pain research that previous history and previous injuries, previous experiences of pain is very, very important in terms of how the body kind of reacts to that. And we use, I think in the mentorship called a body scan, where we just go through the whole body and kind of figure out where this person's had injuries before. Now, it's a really, really useful tool to kind of help organize your thoughts in the subjective assessment, is to draw out like the subjective timeline. So if you draw a kind of rough timeline, and obviously this point is going to be their current pain experience. So let's say we've got a patient with left-sided low back pain. Now, if we go through that person's history, we might find that, okay, the first big injury that they can remember, we don't have to write everything down here, but it's the big injuries that we think might have some relevance. So let's say it's 2020 now, nearly 2021, but 2020, that person's getting left low back pain. If we go back to, let's say, 2018, maybe there's a right ankle sprain. And then let's say maybe 2019, there's an instance of right-sided low back pain. Maybe then late 2019, later on in the year, maybe there's a left-sided hip pain. And then obviously the current experience of left-side low back pain. So if they're the relevant physical histories, we might have some non-physical stuff there as well. So maybe at this point, maybe there's a period of high stress or whatever. Now, obviously, you're gonna have to make this relevant to your patient in front of you. But what I wanna get at here is we might have a current experience of left low back pain, but if we trace this back, there could be adaptations that have happened from the 2018 injury, the right ankle sprain, especially if they didn't have any treatment at this point, if it kind of just let it recover on its own. So this is the kind of starting point of a cascade of events that then led to right-sided low back pain, then left hip pain, and then left low back pain. Now, we'd just be guilty of getting the symptoms to settle down if we just treat the left side of low back pain. But what might be really important is that we need to look at this right ankle, we need to look at this right hip, and maybe there's adaptations on the right side, they're now favoring that left side, and that's why this left low back pain is now kind of causing a problem. Now, there's going to be a lot of clues for this in the subjective assessment. So the mechanism for how this low back pain started is going to be important. Were they in a position where they needed to use that right leg maybe, and they don't want to use the right leg because there's a perceived threat from this right ankle that hasn't been rehabbed properly, so they overwork the left low back and the left low back's gone into spasm maybe. Again, this is all hypothetical. Likewise, then we need the assessment skills to be able to figure out, is there actually a problem at that right ankle? So again, all we're doing at the moment in our subjective, when we're organizing our thoughts, is organizing our hypothesis. Obviously then we need the assessment skills, because we can't say just because they've had an ankle injury, that's why the left low back pain is now on. But we need the assessment skills to figure out, okay, what are the skills maybe they're lacking around that right ankle that we might need to give them back to be able to make sure this left low back pain doesn't come back again, okay? So I'm not saying we're going to jump and start treating the right ankle straight away. Obviously, we need to desensitize the symptoms first. That might be your first 2 to 3 sessions. But then if we're really going to make sure that this patient's pain doesn't come back again, obviously we need to find what are the adaptations maybe that happened before the left low back pain that then we might need to treat to make sure the pain doesn't come back again. Okay, so again, this is a really nice way to organize your thoughts. It's very crude, very basic, but it really helps me in the real world when I'm with a patient in front of me to be able to organize my thoughts, form my hypothesis, get a rough structure in place. And as you'll see in the next video, that's going to be really, really important when it comes to actually designing the treatment plan. because when I design the treatment plan, obviously I'm going to be giving the patient a prognosis. If I don't appreciate that all this stuff down here might be having a relevance now, obviously if it was just the left low back pain, I might be looking at maybe 4 or 5 sessions, obviously depending on how acute it is. But if I've got a lot of stuff to do around the right ankle and the right hip as well, now obviously I'm probably adding another 4 or 5 sessions onto that. So again, it just helps me to give a more realistic and a more accurate prognosis to the patient, and it helps them to understand, organize a treatment plan now to help this person get back to where they need to be able to go.